This video will demonstrate the procedure for bone marrow aspiration and bone marrow biopsy from the posterior iliac crest. Obtaining a bone marrow aspirate and core biopsy is often necessary when evaluating a patient who has a hematologic abnormality. Examining bone marrow is also useful in the diagnosis of metastatic spread of non-hematologic malignancies and to diagnose metabolic disorders. Gather the necessary equipment prior to performing the procedure. You will require equipment for sterile skin preparation and a sterile field, 1% lidocaine buffered with sterile sodium bicarbonate, a 25-gauge needle and 5-milliliter syringe, a bone marrow aspiration needle, a bone marrow biopsy needle, 2 30-milliliter syringes, sterile heparin sulfate, sterile gauze, and bandage. Several types of bone marrow biopsy needles are commercially available. This video will demonstrate the use of the Jamshidi needle for obtaining a core biopsy. Bone marrow aspiration and biopsy should not be performed if an infection of the bone is suspected. The posterior iliac crest is the most common site used to obtain bone marrow. This site can be reached with the patient in either the prone or decubitus position. This video will demonstrate the decubitus position. The patient should be positioned in the right or left lateral decubitus position with knees flexed. The posterior iliac crest is located at the center of the posterior superior iliac spine. Iliac crest may be performed. Though the sternum can be used to obtain a bone marrow aspiration under exceptional circumstances, it is not suitable for a bone marrow biopsy. Once the patient is positioned, the site should be prepped with a chlorhexidine scrub and draped with sterile towels. As with all invasive procedures, meticulous care should be taken to minimize the risk of infection. While the invasiveness of the procedure may not necessitate a sterile gown and mask, the operator should don sterile gloves and adhere to strict standard precautions. Local or systemic analgesia, or both, may be indicated. After sterile preparation, 1% lidocaine should be slowly injected to raise a wheal over the biopsy site. Then, infiltrate the periosteum with 2 to 5 milliliters of buffered lidocaine. In the awake patient, ensure the adequacy of local anesthesia by gently tapping the periosteum with the tip of the needle used to deliver the. Inspect the bone marrow aspiration needle and remove the plastic guard if one is present. Hold the needle horizontally and insert it into the skin over the posterior iliac crest. Advance the needle until it contacts bone. To engage the bone, the needle should be rotated alternately, clockwise and counterclockwise, while applying steady pressure. When the marrow cavity is entered, a sudden decrease in resistance is usually felt. The ilium is a large bone, and the marrow space should be located easily. However, the angle of entry is important. In general, the needle should be advanced at an angle completely perpendicular to the bony prominence of the iliac crest. Once the needle is through cortex and the marrow cavity is entered, the needle should stay in place without being held. Next, remove the stylet. Attach a 30-milliliter syringe without heparin and aspirate 1 milliliter of marrow with a firm pull. Since the aspiration itself can be particularly painful, it is prudent to warn the conscious patient before you aspirate. Note that you may hand a syringe to an assistant or pathologist, taking care to maintain sterility. The non-heparinized aspirate should be used to prepare specimen slides. Adequacy of the specimen can be verified by the presence of bony spicules in the sample. Next, aspirate marrow into syringes containing 1 milliliter heparin as needed for diagnostic tests. Remove the aspiration needle and apply pressure with sterile gauze until you are ready to perform the biopsy. Bone marrow biopsy is often done following a bone marrow aspiration. Maintaining sterility, obtain a bone marrow biopsy needle. Holding the needle between your palm and index finger, insert the needle into the patient's skin and advance until it touches bone. If an aspirate has been performed, the same entry site through the skin may be used for the biopsy. However, a skin incision may be indicated if only a bone marrow biopsy is being done, or after an aspirate to allow for entry of the larger biopsy needle. While applying steady pressure, advance the needle with its stylet in place into the cortex by rotating back and forth. The biopsy needle should be inserted into bone at a slightly different angle than a previously performed aspiration. Once the needle is anchored in bone, remove the stylet. Continue to advance the needle 1 to 2 centimeters into the marrow cavity with a back and forth rotating motion. The stylet may be reinserted to determine the length of the biopsy specimen in the needle. In order to remove the biopsy specimen, it must be detached from the surrounding marrow and bone. Do not pull the needle straight out, as doing so may allow the specimen to remain attached to surrounding marrow and prevent it from being removed in the needle. Rotate the needle 360 degrees several times in both clockwise and counterclockwise directions prior to removal. The needle should then be rocked back and forth to ensure detachment of the specimen from surrounding marrow. Slowly pull the needle out while continuing to rotate. Remove the specimen from the needle by inserting a sterile probe into the distal end of the needle and push the specimen through the hub onto sterile gauze or a slide. Inspect the specimen for adequacy of marrow. Apply pressure to the biopsy site with gauze until any bleeding stops, and cover with a bandage or pressure dressing. Instruct the patient that the dressing can be removed the next day, and that they should protect the wound from contact with water until a firm scab is formed.